COVID-19 demonstrated that pandemics can last much longer than previously anticipated. It lasted 3 years, much longer than the 3 months long response for 2003 SARS and 2009 influenza A H1N1. It also caused massive societal and economic disruption far beyond the health sector. We must therefore prepare and be ready for a protracted, intersectoral, whole-of-Singapore response. To do this, CDA will lead and coordinate public health preparedness and readiness efforts. It will work with stakeholders from various sectors and agencies to build sectoral readiness against infectious disease crisis and to safeguard national interests such as vaccine and therapeutics development and access. CDA will also work with MOH and healthcare institutions to build capabilities and capacity in key areas such as laboratory testing and clinical management. CDA will strengthen our surveillance capabilities, including exploring the use of new modalities of surveillance, such as through genomic testing and wastewater testing to supplement traditional surveillance approaches, and explore data analytics and artificial intelligence to enhance our ability to make sense of large volumes of data. CDA will investigate and respond to cases and outbreaks of infectious diseases in Singapore. This takes place routinely for endemic diseases and during potential crisis. During a pandemic, the approach and strategy will be driven by the Ministry of Health or the equivalent of a multi-ministry task force during COVID-19. CDA will provide policy and scientific recommendations and also work with MOH and other agencies to carry out the operations. This will include a calibrated combination of public health and social measures that include case investigation, contact tracing, masking, physical distancing, and border control measures. Finally, CDA needs to support its function with strategic enablers. One important enabler is research. Research is an important aspect of preparation to ensure a scientifically robust, data-driven response to infectious diseases. For instance, research conducted during COVID-19 allowed us to determine the duration people infected by COVID-19 were likely to remain infectious. This in turn informed the duration of isolation for these individuals so as to prevent transmission. CDA will coordinate and conduct public health research. It will make use of the findings from local and international studies and translate research findings into public health and clinical actions and policies. Another key enabler is international cooperation. The next pandemic is likely to come from abroad. CDA will also engage overseas stakeholders and counterparts to enable Singapore to respond swiftly to rapidly evolving global disease situations. This allows us to access and share information, expertise, and the latest developments and best practices in infectious diseases control. This will also allow us to detect international emerging situations of concern earlier and buy us invaluable time to prepare for and implement mitigating measures.